During the COVID-19 pandemic, the people operating the most essential day-to-day jobs are the same people that are at the highest risk of becoming infected. While there have been attempts at creating a generalized way of tracking the spread, our essential workers remain exposed with inadequate protection. Due to this, critical companies that continue to operate are at risk of an internal breakout that can not only devastate their workers, but crush an organization that is vital to everyone's daily life. That is where our value proposition comes into play. We provide essential protection for essential workers. Our algorithms track internal viral spreads within your company and predict illness in your employees before symptoms arise in order to help circumvent an internal breakout. Our system is designed to prevent companies from experiencing a complete breakdown, helping them save costs in healthcare for sick employees, save on the opportunity cost of having to temporarily shut down, and save on the hiring costs of new talent acquisition. Now, I'm going to move on to the tech demo. This is going to be the employer's perspective. So first, this is represents the back-end work that will allow executives to understand the big picture of their employees' well-being. What you're looking at is a live simulation where each second of real time is represented as an hour within the simulation. Here we are monitoring the status of all of our employees for a small essential business. The column of primary concern is deviation, which we are using to detect anomalies in a particular employee's health. For the sake of presentation, I rigged a single person with a COVID-19 infection, and although symptoms have yet to arise, we can use indicators such as rise in heart rate and skin temperature to determine that a person is having an immune system response. We can also utilize declining O2 levels to narrow in on the likelihood that a person has been infected with COVID-19. After a specified period of time, in this case 24 hours, we are given this alert that an employee has been undergoing irregular patterns. It goes on to describe what that anomaly is and could potentially mean, while also informing the reader of the number of individuals that person has interacted with over a potentially infectious period. We can dive further into this by clicking Analyze, which will give us a set of informational arrays. These tell us the name of the individual, where and when they interacted, and a weight integer. The weight integer is designed to increase the longer the two individuals interact, as their likelihood of catching an illness increases in a linear manner to the amount of time spent together. This gives us insight to the back-end framework, and now I will leave it to Hyeyun to discuss further on the biomedical perspective.
Yeah, let's look at it in the perspective of biomedical knowledge. Like in case of the COVID-19, the three most general symptoms are fever, dry cough, and the tiredness. There are several ways to detect if the user has symptoms or not. Like first of all, in case of fever, we can derive the data from ECG and the heart rate. The interval between each point in ECG vary by the body temperature. And about the heart rhythm, the 1 degree Celsius increases while the temperature inclines about the 8 beats per minute. Even normal sleeping heart rate was 10 beats higher while fighting the virus. Next, the correlation between the oxygen level and the skin temperature can detect the existence of the virus, which can affect our alarming service. Like it originally fluctuates, but the high variation is linked to the breathing issues, which changes in your blood oxygen saturation, and it is finally connected to the skin temperature. In addition, the tiredness is measured by the irregular sleep cycle. The next step is our market entry. First of all, the number of Fitbit users and the Apple Watch users, which are two major companies, is over 150 million, and this is consistently increased for 8 years. And the death rate is decreased about 1/5 by using the tracking system. The market we are targeting specifically is the patient application, like precision medicine and application to monitor or alert and medical data management, which works for the electronic health records and real-time delivery data. The market is forecasted to be over $50 billion, which seems worth enough to initiate the innovation.
One second. Okay. Hi, guys. So for our app design, there were 3 things that we wanted to emphasize, which is 1, informing the user, 2, showing that we can empathize with the user, and 3, keeping it as simple as possible. So for our onboarding screens, we wanted the users to be informed about statistics with COVID, show them that it is scary and we can empathize with them. but that there is something that they can do through our app and through simply registering for an account. For security, we tried to have a two-part verification system so that simply by using an email pin that they can enter, they would be able to enter the second layer where we send them a text and then they enter that code. And then finally, all they have to do is log on and their account is already pre-made for them based on information we had previously received from their company. Now logging onto the home screen, for the daily surveys, one thing we wanted to do was acknowledge that workers are busy, so it's good to keep it just short and simple. And so what users can do is just start here and really self-evaluate their own health conditions, such as their cough status, and then their fever status, as well as things like sleep quality. And just like that, the survey is complete. And yeah, it's just kept simple for workers to go back to work, not a huge burden. And then another feature of our app is notifications. So this screen allows users to get an overview for their company and really see how different departments or teams and cities are doing, as well as receive different announcements from company leadership, whether that's encouragement or just news about COVID. And lastly, to inform users about their own health conditions, we allow them to tap into features where they can monitor their own weekly progress, whether that's on things about their heart rate, their skin temperature, or their oxygen level, all based on the algorithms that Devin had talked about earlier.
When this all began, our learning journey started as a senior care center focused healthcare team. Our goal was optimizing water management systems, emergency detection and response, and community engagement. When COVID-19 hit, we realized that what we were building could pivot to become applicable to what's happening in the world today. Rather than tracking the elderly, we looked to track the virus using low energy Bluetooth interaction. A few days later though, Apple and Google came out saying that they were working on a system that would be built into their OS. Their white pages read almost word for word with our vision. We had to find our secret sauce. That's when we looked back to our original algorithms and realized that rather than predicting heart attacks or strokes in the elderly, we could use the smartwatch data to detect an immune response based off of past studies, correlating heart rate, O2 levels, and skin temperature to an immune system response before symptoms appear. And then, as we should have expected, a few days later, Fitbit, Stanford, and Scripps came out saying they were working on the same thing. But we realized that there was a missing component. These tech giants had focused so much on generalization and abstraction, with privacy being of utmost importance, that their products would fail to adequately protect those most in need of protection, essential workers. That's where we come in. We don't rely on an opt-in service that is anonymous. Instead, we help companies closely monitor their employees and know exactly who is getting sick and who they have interacted with. Now, moving forward with 5G implications, 5G would really allow for the elimination of needing to install these Bluetooth receivers in every room of a company's building in order to reach peak accuracy. Instead, the existing connectivity solution could provide reliable, accurate data to serve the same purpose. The network would hold better encryption, and the low latency would allow for a continuous stream of information. Additionally, the environment that would be established during this crisis would be an ideal entry point for additional verticals, including emergency detection and response, as well as inventory control of water management. Even without COVID-19, monitoring the general health and stress levels of employees can prove to be a valuable asset to keeping the morale high within an organization. Furthermore, this provides an opportunity to partner with a telecommunication company and give them a particular distinction from their competitors. Not only would they be able to offer their standard connectivity solutions, but they could supplement their packages with a built-in healthcare system that works cohesively with the existing 5G network. This gives them a unique edge without requiring additional internal distractions. Thank you for your time.